Hello, good afternoon. My name is Dr. Chudi Ufundu. Thank you and welcome to our weekend open clinic with Dr. Chudi. Today we're going to talk about a topic of great importance. We are going to talk about the egg quality. So we're going to look at female fertility, the egg quality, and your chances of becoming pregnant. Now, this is a topic you don't want to miss for anything. So I'm going to give a few minutes for people to join. Then we're going to have a very extensive discussion about your eggs, about your fertility, then about your chances of becoming pregnant. So you need to be conversant with this body. You see, this is a very beautifully made female reproductive system. This is where the journey begins. Everything about fertility, everything about pregnancy is centered on the eggs. The eggs is the most important component of becoming pregnant, and not just becoming pregnant, but also having a very successful pregnancy. Very important topic. So when you come in, confirm you can hear me, confirm you can see me, and please, I need to know your location. I'm located in Tampa, Florida. I'm the convener of a group. The group, it's a group that centers on education. Our aim is to educate people on basic things that will help you to become. So my community is Snowspirations, Global Health Solutions. Our aim is to give you the basic information you need so you can know better. And when you know better, you can change your attitude. And when you change your attitude, you can change your practices, you can change your perception, and you can become exactly what God made you to become. Now, every woman in attendance today should be conversant with this because this is the most important component if you want to be a mother. So I'm going to still give you a few minutes. I want you to introduce yourself. So I can see Tosi from New Jersey. I can see Onyx Christie. I want to know where you're located. I can see Chinyere from Port Harcourt. And my admin will soon join. Kenneth will soon join from New York. So please sit back and have your questions ready. Esther, thank you so much. Please, when you come in, I need to know your location. Very important. Our group is a global brand. It's not a Nigerian brand. It's a global brand. And regardless of where you live, you can get help. This topic is a topic of great importance, especially to people that want to start their families and they probably have problems. You're going to tackle the problems, and at the end of today's presentation, you will know better. So I'm actually going to start. So you see, when you were born and you came into this world as a girl, you came into the world with all the eggs you will use to start your family. Approximately about 1 million eggs. 1 million eggs. And those eggs are resident in the ovaries. You have 2 ovaries. So thankfully, God, in his own infinite mercy and wisdom, gave us alternatives. So every woman has left ovary, right ovary. Inside that ovary are all your eggs, the whole eggs you will use to start your family. But as you are getting older, the eggs will be getting reduced in number. By the time you come to puberty, you will have approximately 300,000 remaining out of the millions, because every day you lose a lot of eggs, which happens on daily basis. Then it also happens on monthly basis. So there are so many eggs that will be lost. Now, by the time you get old, so what do I mean by old? In maternal health, we define old age infertility. So it's just a concept you need to understand. When you get to 35, you are classified as advanced in maternal age. It's a medical terminology. It doesn't mean you're a grandmother. It means the eggs are reducing in quantity and quality. It means we need to be proactive, conscientious in our approach. Now, your eggs will determine if you're going to be a mother or not. The best time to become pregnant with the eggs that God gave you is in your 20s. So by default, every woman will release 1 egg every cycle, one egg, if everything is okay, it's expected that some hormones will work on the ovaries and they will start developing one particular egg. That egg will develop in the follicle. So follicle is like a container where the eggs will develop. At the end of the development of that follicle, the follicle will be big. By that age, we call it dominant follicle. When the follicle is ready, the follicle will burst open to release the egg. The process of releasing the egg is simply what ovulation is all about. Now, this is the expectation. It's expected that a woman will release one egg at the middle of her cycle. Your cycle is what you should be conversant with. That process of releasing the egg is under the influence of hormones. Follicular stimulating hormone, luteinizing hormone, estrogen, progesterone. These are the major reproductive hormones. So the aim of doing all these things is to get a woman pregnant. So every woman in their reproductive phase is supposed to be pregnant every single month. That's standard. Now, the ability of you to become pregnant is based on the quality of your eggs. Now, by default, at any age, you will have abnormal eggs and normal eggs. Unfortunately, as you are getting older, you will have more abnormal eggs compared to normal eggs. Now, when you are younger, because you have a greater percentage of normal eggs, every month you release your egg, you will have normal egg. The probability is high when you're younger. Now, but when you begin to get to 35, if the egg you're releasing in that month, it's not normal. Remember, you have greater percentage of abnormal eggs as you're getting older. It doesn't mean you don't have good eggs. You still have good eggs, but they are fewer in number. And in statistics, the more you have something, the more they will manifest. So when you get to 35, the possibility that on a monthly basis, the egg you will release would have reduced in quality is there. Now, life is about what you give. What you give is what you get. So if you're getting older and maybe by monthly you're releasing abnormal eggs, that abnormal eggs you release will not be fertilized. Majority of them will not be fertilized. Some of them might be fertilized, but they will have problems. They will have miscarriage. They will have stillbirth. Or when the baby is born, the baby will be born with syndrome. So life, it's very important. The process of reproduction is a very stepwise important process. So you need to be in the know in regards to what God gave you. Unfortunately, or fortunately, everybody's going to age, right? So aging is a very natural process, just like pregnancy. Pregnancy is not a disease. Age is not a disease. Menopause is not a disease. We are all going to age. If you want to become pregnant, you're going to become pregnant. But when those changes come, they come with different changes and expectations. So every woman will go through the puberty, 20, 30, 40, 50. The older you get, the more difficult it becomes. It's difficulty, it's challenging. It doesn't mean it's impossible. You can still become, but you need to know what you need to do. Unfortunately, there is no magic drug that once your eggs are done, then when you take those drugs, your eggs will become quality overnight. There is no such drug, my people. What can you do in that regard? Lifestyle modification. If you live healthy, if you eat good food, if you drink your water, if you don't smoke, if you don't take excessive alcohol, if you avoid stress, if you sleep, your body will perform optimally the way that God structured it. Because the body of a woman is prone to having a lot of problems. Original design of how God planned you to be will affect your ability to reduce your egg. So stress can affect the quality of your eggs. Lack of exercise can affect the quality of your eggs. Extreme weight loss can affect the quality of your eggs. Extreme weight gain can affect the quality of your eggs. Toxic relationship, stressful events, extreme sports, they can all affect your ability to release the eggs you have, especially if you have reached 35. So what happens by the time you get to 35? You have fewer eggs. And out of those fewer eggs, majority of them are abnormal. So when you release the abnormal eggs, they will not fertilize. But if you happen to release the normal one, they will fertilize. So your eggs are directly related to your fertility as a woman. And they are not going to be there forever. They will end. When your eggs, when you finish using all the eggs you have, you go into menopause. Can you still become pregnant when you go into menopause? Yes. What do you need? Donor eggs. Now, I'm not going to use fortunately or fortunately. These are things that will happen by default. By the time you get to 40, you can still use the eggs you have. If you release the normal one, they will still be fertilized, but the chances are reduced to 5% as compared to 25% when you're in your 20s. So a woman in her 40s can still become pregnant naturally without any help, but the chances are 5%. So compare 5% to 25%. Now, when you're in your 20s, if you practice regular lovemaking with your partner, within 1 year, 12 calendar months, 12 calendar year, you have 89 to 90% of becoming pregnant. So couples that are below 35, nearer to 20, if you and your partner are living together and you are exercising and you're doing the right things and you are making love, love making is at the center of everything. You are not targeting when to make love. You are not only making the love when you think you're ovulating or your infertility window. You are making love regularly. You are not using any contraceptives. By the end of the 12 months, you have 89 to 90% of becoming pregnant. But when you get to 40, that chance is grossly reduced. So the key word is timing. What are you going to do at 35? What are you going to do at 40? If you want to be a mother at 40, what do you need to do? Which approach do you need to take? In as much as you can still have opportunity to become pregnant naturally. Now, there are a couple of investigations we can use to know the state of your eggs, to know the quantity, but it's difficult to really assess the quality. Now, every woman in our community who is believing God for a baby is advised to go for ovarian reserve test. Your ovarian reserve test will give us an idea of the likelihood of the number of eggs you might still have. There is a special test we use in checking that. It's called AMH, anti-Mullerian hormone. The level of your anti-Mullerian hormone will tell us the likely quantity of the eggs you have. Unfortunately, it's not going to tell us about the quality. So if your AMH is reduced, then the likelihood is that your fertility is reducing. We want your AMH to be within a normal range. But when we check your AMH and it's reduced, and your FSH, which is follicular stimulating hormone, which FSH and LH and estrogen, they have love-hate relationship. When your FSH is going up, it's an indication that your fertility is reducing. You are getting ready to enter menopause because your estrogen will by default will be reducing. When you are getting older, your estrogen will be reducing. So if FSH goes up, your estrogen is down, your AMH is down, likelihood you are gradually tilting towards menopause, or you're gradually going into premature ovarian failure. When this happens before 40 years, it's called premature ovarian failure or premature or primary ovarian insufficiency. So there is need for you to know where you stand, for you to know your status, for you to know your option. So it won't make sense to be in your 45 and you're just hoping on hopes if you want to be a mother. Because unfortunately, by the time you really enter menopause, your fertility would have started declining 10 years earlier. Most women will enter menopause at age 50. But by the time you get to that menopause, you are already contending with challenges because the premenopausal period and perimenopausal period, your fertility is already dwindling. This is why we advise women, once you get to that 35 age, please begin to seek help immediately. The difference in your egg quality between 25 and 40 years is a matter of statistics. Because at 40 years, you have more abnormal eggs. But at 25, you have more normal eggs. So if you release more normal eggs monthly, the possibility you're going to fertilize them is very high. This is reality, my people. So we need to get on it, get our facts right. The age of the egg is the driving force in getting pregnant. Now, in recent development and in modern technology, Some people that have access to fertility facilities, if you're in your 20s, you can actually go to a fertility specialist and freeze your eggs. An egg that was frozen at age 25 and we reactivated it to use it at 50. When a woman uses an egg she froze at 25, at that 50, that egg is 25 years old. So if you have the facilities and you're young, maybe you're pursuing a career, maybe you don't have a good relationship, maybe for some reason you want to get money and you're not ready in your 20s, which is possible, and you're not ready in your 30s, but later you became ready in your 40s, you can use the eggs you froze at 20 to become pregnant at 50, to become pregnant at 40. When you use the eggs you froze at 20, in your 40s, in your 50s, the age of that egg will be 20 in your 50s, in your 40s. This is practicable. So please, if you want to join the podium of women who will celebrate in our group, get on it. Go seek help. We can help you. I can help you. When you come in and subscribe, I can review your case. I can determine what's going on. Then I can refer you to a provider that will check your fertility assessment. There are basic things we have to check, and we are talking about the woman. There are so many other things we have to talk about the man. Fertility and pregnancy is a game of two people. The woman will come in, the man will come in, then we combine both of them, then we'll see what the problem is. Sometimes you won't know what the problem is, and you're still having problems becoming pregnant. Now, there are two types of infertility you need to be conversant with. Primary infertility, secondary infertility. Compared to the two, primary infertility is tougher to handle because if you have never been pregnant, it's tough. But if you were pregnant in the past, but currently you're not able to become pregnant, you have secondary infertility. So if we can figure out why you couldn't become pregnant now, the possibility of becoming pregnant again is very high for a woman that has been pregnant in the past. So if you were pregnant in your 20s, in your 30s, now you're in your 40s, you're not able to achieve pregnancy. The fact you have been able to achieve pregnancy before gives you an advantage compared to a woman that has never been pregnant in life. So primary infertility is more difficult to handle, but it's not impossible. It's still possible, but you need to meet the right kind of people. So at the center of your fertility, at the center of becoming pregnant is your egg. Your egg is the most important factor. What you have is what you will use. If you have good eggs, it will give you good embryo. If you have good embryo, the possibility you have good baby without complications is very high. If you have bad eggs, some of them will not fertilize, some of them might fertilize, you miscarry them, or you have stillbirth, or when you give birth to your baby, you begin to have problems. So age is very important. Okay, now I'm going to open the clinic, and I'm going to allow us to interact. So this is an interactive phase now. You hit me up, you ask me questions, I provide you feedbacks. If today is the first day of attending my clinic, thank you so much. Every Saturday by this time, 12 p.m. Eastern time, 5 p.m. Nigerian time, when you show up here, you will see me talking about the topics I love talking about. Now, on Tuesdays, I also show up, but I show up much later, 6 p.m. Eastern time, US, 11 p.m. Nigeria. But right now, let's take care of your questions, okay? Feel free to ask your questions. I provide you feedbacks. This is live. If you've been seeking Dr. Chudi, this is an opportunity to talk to me directly. So please, the floor is open. Go ahead and ask your questions. I provide you feedbacks. Please remember to share this video with all your friends. Please remember to subscribe. Remember to comment. There are so many other important videos you will find useful. And we love each other in our community. So if you need help, ask and you will be given some help. But right now, please ask your questions. I'm ready to take care of your questions. And your questions can come from any part of this beautiful reproductive system. If you have questions, please ask so we can talk and you can get help and you can go and do what you need to do. Okay. So the first question says, how do you know if your eggs are good to get pregnant? Ovarian reserve test. Ovarian reserve test. So we need to check your AMH, anti-Mullerian hormone. We need to check your FSH. We need to check your LH. We need to check your estrogen. We need to check your progesterone. We need to run a complete hormonal profile. But what we are looking out for in regards to your eggs, quantity-wise, is your AMH. So I'll give you an example. If you're in your 40s and we check your AMH and it's grossly below normal range, grossly low, and we check your FSH and it's very high, and you have not bled for the last 12 months, you have gone into menopause until proven otherwise. Because menopause is the absence of bleeding for 12 consecutive months with other antecedent clinical presentations. So if you have not bled, if you suddenly notice low libido, if you suddenly notice dryness of your vagina, if you suddenly notice hot flushes, and you have not bled for 12 months, and you go to the lab, and we notice that your AMH is down, FSH is up, estrogen is down, likelihood you've gone into menopause is high. And when you go into menopause, can you still have a baby? Yes. But what do you need? Donor eggs. So if you have not seen a fertility specialist, this is not a case of, oh, don't give me the test to go and do. No, you need to present yourself to the fertility specialist. We need to ask you some questions. We need to examine you. We need to send you to the lab. Then when we ask you questions, we examine you, we get the lab result, we find a diagnosis. We need to have a working diagnosis. Pregnancy is not a trial and error thing. We need to know what the problem is, so we begin to tackle it appropriately. Okay, so ovarian reserve test is what you need, my sister. If a woman's egg dwindles with age, can the same be said for the man? Yes, but guess what? Men have a better advantage. Men do not go into menopause. Women go through menopause. So a man's infertility can dwindle with age. The man's ability to father a child can dwindle with age, but he still can. He might have possibility of having babies that might have challenges late in 80s, 70s, 90s, but he still can. But once a woman hits menopause, she cannot by herself, naturally. But a man can still get a woman pregnant in his 70s, in his 80s, in his 90s. So age can affect men the same way it can affect women, but age affects women more than men. Do you understand the logic? Let me give you an example. If you are 50, as a woman, possibility you're perimenopausal, possibility you're menopausal is very high. Possibility you no longer have X. Now your partner can be 70, you're 50. What are you guys' best chance of becoming parents? Reality check. What's your best chance if you're 50? You go for donor X without wasting time, immediately, without wasting time. Now, if we check your partner's sperm at 70, and we are okay with the motility, we are okay with the morphology, we are okay with the count, we can use his own sperm to use another person's egg to donor provision to get you guys pregnant. Now, if that fails, you can go for adoption. You can go for surrogacy. So the watchword is what you have. What you have is what you will receive. If you have good eggs, if you have good sperm, if you have good embryo, the possibility you have good pregnancy is very high. Now, there are so many things that can happen in pregnancy. There are so many women that will do the right things, and unfortunately, they can still have miscarriage or stillbirth. Sometimes we don't know. There are certain things in medical practice we don't know. But you need to equip yourself with the right kind of attitude, with the right kind of lifestyle that will help you to become. Because when you don't know, you don't know. And that's where specialists can come in. The best person to help you to figure out the problem you're having with your fertility is a fertility specialist. Okay, let's continue, guys. How can you book an appointment? You subscribe. Admin is going to set you up. Once you subscribe, they will set you up with me one-on-one. Then I will take up your case. I will review your case. I will ask you a lot of questions. I love asking questions. I will ask you about 27 questions. From the questions, I can develop my theory. I can develop my case. Then I will refer you if need be. Some people might not even have any need to be referred. They will just need to go back home and do the right things. There are some people that are not having problems with infertility. You're not just making love enough. You're not making love the right way. Some people are still timing their love making. Some people are pretending they are making love, but they are not making love. The best way to become pregnant in April, admin, please capture that for me. The best way, method, fastest way to become pregnant in April is love making. Rain, shine, it doesn't matter, make love. If you want to make love during your bleeding too, please do that. It's okay. If both of you agree, there is medically no problem with that. But you must make love. If you want to become pregnant naturally, you must increase your frequency of love making. Okay? All right, let's continue. You've been pregnant before, but you're finding it difficult to become pregnant. You're 26. My sister, at 26, you're very young. Okay, so I don't know what's going on. I don't know the duration of these current problems you're having. I don't know if you're having frequent, regular lovemaking with your partner. I don't know. So what I will tell you is this: 26, you're very, very young. Okay, very, very young. So increase the frequency of your love making. If this has dragged for 12 months, then you have infertility. If it has not reached 12 months, you don't have infertility. Infertility is defined as the inability when you get to 12 months or 6 months, if you're above 35. So in your 26, if you just noticed it for 3 months, it's not infertility. It's until you've gotten to 12 months. So go back home and make love with your partner. Now, if you have passed the 12-month mark, then you seek help from a fertility specialist. Importantly, now when you're going for fertility specialist treatment, it doesn't matter whatever they tell you. They can tell so many of you, oh, you go for IVF, oh, go for IUI. It doesn't matter. Still go back home and make love. There are so many members of our community that became pregnant even when they were shopping for money for IVF, for IUI, for surrogacy, for adoption. Suddenly they became pregnant. How did they become pregnant? They were making love. So at the center of everything you need to do in this community is what? Love making. Go back home and make love. Okay, will you advise a woman in her 50s who froze her eggs in her 20s carry her pregnancy or opt for surrogacy? You can carry your pregnancy. Now, this is the criteria. We have to still check your body. If your body is good, if your hormones are good, if we can support your body, then you can carry your baby. There are so many women that will naturally carry their baby at 50. So your body will determine what we will do. If we have some reasons to believe that your womb will not carry your baby, then we go for surrogacy. So I won't just tell you, oh, because you're 50 and you froze your eggs in your 20, then you're not qualified to carry your baby. No, we can only say that based on our assessment. So when we assess you, we assess your womb, we assess your hormones, we see if we can support you. If your womb is okay, you can carry your baby. But if your womb is not okay, there are some women that unfortunately they can't carry their baby. They have the eggs. They have the ability to become pregnant, but their womb cannot carry their baby. In that situation, we begin to look for surrogacy. Surrogacy simply means we have another woman that will carry your baby because your womb cannot carry your baby. Unfortunately, some women find themselves in this position, but guess what? That surrogate baby is your baby. There is no difference. Okay? All right. Does folic acid improve egg quality? No, my sister. Folic acid is a preventative drug. When you're taking your folic acid, you are helping the neurotubes. So there's a special place that the nervous system, the brain, the spinal cord develops. It's called the neurotubes. When you have adequate quantity of your folic acid, when you eventually become pregnant, the brain, the spinal cord, and all the nervous system of your baby will develop properly. When you don't have adequate levels of your folic acid, when you eventually become pregnant, you might have neural tube disorder. An example is spinal bifida. So imagine having a baby born and the back is open, the back of the neck is open because of something we could have prevented. So when you're taking your folic acid is not a fertility drug. Your folic acid will not have a direct impact in your egg. If there, hopefully later in the future, we can find a drug that once you take it, your quality of eggs should just be 100%. But right now, we don't have such drugs. So your folic acid is specifically enabling you to make sure that when you eventually become pregnant, your baby will be fine. So all women, across the board, so long as you're making love, start taking your folic acid, which is already contained in your prenatal multivitamins. Read the contents. Make sure it contains 400 to 600 microgram of folic acid. Now, there are so many other important components in your prenatal multivitamin. So don't just wait to become pregnant before you start taking your prenatal multivitamins. Start taking it immediately. Okay, correct. I mean, the fastest way to become pregnant in April is through lovemaking, frequent lovemaking. Regardless of rain, regardless of shine, regardless of your quarrel, regardless if you're in pain or in sweetness, it doesn't matter, make love. Okay? Your question goes like this. If a woman does not have a boyfriend, does not marry, she is single, can she become pregnant? 100%. Whether you have a boyfriend, whether you're married, whether you're divorced, it doesn't matter. Your body is your body. The eggs that God gave you is still there. So when you're ready, you can become pregnant. So your ability to become pregnant is not dependent on if you have a boyfriend, if you have a husband or not. When you are ready, when the right man comes, you become pregnant. Okay? So 100%. Can you menstruate when you are pregnant? No. Any form of bleeding during pregnancy is treated as abnormality. Now, some of those bleeding can be normal, like implantation bleeding, but any other form of bleeding, any shape or form, tiny spotting, big bleeding, call your doctor immediately. Now, when you're done calling your doctor, there are 3 things I want you to observe immediately. Suspend all sexual activities immediately. Suspend all sporting activities immediately. Suspend all stressing activities immediately. So I want you to observe 3 S's. No sex, no sports, no stress. Admin, please capture that for me. No sex, no form of sex. Now, having sex directly will not lead to infertility. But if you are already having what we call threatened abortion, then the facilitation might be there. So there are some women that might have recurrent miscarriages or issues, and once they become pregnant, we tell them not to make love. We are telling you not to make love, not because love making can lead to miscarriage, but love making can facilitate that. The same thing is applicable to sports. So you are actually a candidate that will go on conservative approach in management of your pregnancy. If you notice, there are some women that when they are having problems, we tell them to go back home and go on strict bed rest. When we give you strict bed rest, we mean it. When we tell you to go on strict bed rest, please don't go doing domestic chores. Don't go driving. Don't go doing stuff. Don't do it. Be on strict bed rest. The only time you can get up is to go and pee. Then go back. Very important. Follow the instructions, okay? But please, once you are pregnant, any form of bleeding whatsoever, it's abnormal. Now, I've seen women that say, but dog, when I was pregnant, I was bleeding the whole 8 months. What you had is abnormal bleeding for the whole 8 months. Bleeding in pregnancy, it's completely abnormal. Okay? All right. Okay. Okay. Can you go for IVF in Italy at 45? Why not? Matter of fact, at 45, your best chance of actually having a baby in 2020 is IVF. Now, when you're going for IVF at 45, I'll give you a very good brotherly advice. Consider donor eggs. Any woman in my community today, if you have made up your mind to go for IVF and you are in your 40s, when you get there, when we offer you donor eggs, please take it. We will not just arrest you and offer you donor eggs. We would have checked your eggs. So when we check your eggs, if we have fewer eggs, and if their quality is not good, please don't stand your ground to use a poor quality egg to go for IVF. What's going to happen? You will have a poor quality outcome. We want you to succeed. So at your 45, I don't want you to be stubborn. I don't want you to insist, I'm going to use my eggs. I want to do this. What you will use is dependent on what you have. So when we offer you donor eggs, please take your donor eggs, your donor sperm. They will produce the same baby. Your baby is your baby. There is no difference. Please. Okay? Does the age a woman go into menopause? Okay, I'm trying to link it up. I think you wanted to ask about the age a woman goes into menopause. So it's a range. On the average, most women will go into menopause about age 51. Now, some families, it might be genetic. So we can comfortably predict the time you will go into menopause based on your mother's menopause. So if your mother bled up to 50s, the possibility you will bleed up to 50s is very high. If your mother went into menopause at age 40, the possibility you go into menopause at age 40 is very high. So it can be genetic. It can be familial. So the answer is yes. Okay? All right. Is there a relationship between air quality and miscarriage? This is a very, very important question that my COO reminded me. The answer is yes. The quality of your eggs will determine the likelihood, the probability, the potentials of having miscarriage. And your age. Unfortunately, the older you are, the more the likelihood you're going to have miscarriage. And those miscarriages you will have will be based on the quality of eggs. So poor quality eggs will likely be miscarried. Now, do you know what happened in miscarriage? Miscarriage is protective. You see, our body wants the best. God wants the best. So in a woman's body, when pregnancy is going on, the body wants A-grade embryo, A-grade baby. Anything that compromises standard, the body wants to end it. My people, you will not understand it. I'm telling you medically the fact. The reason why miscarriage happens most times is based on genetic abnormality, chromosomal abnormality. Your body doesn't want what is going on. Your body wants to reject it because, your body wants the best. So anything that is not the best, your body will reject it. This is what happens in miscarriage. Remember that miscarriage is the unintended loss of your pregnancy before 20 weeks. If it happens beyond 20 weeks, it's called stillbirth. So yes, the quality of your eggs can predict if you're going to have miscarriage. Unfortunately, women above 35 will have an increase in probability of having miscarriage. So this is why you need to be careful. This is why when you become pregnant and we ask you your age, if you notice, anytime you become pregnant and you come to the clinic and we ask you, you say you're 35, you say you're 36, guess what? We'll give you a promotion. We want to put you in a place where we'll be seeing you frequently. So we want to see you frequently because during ANC, what are we doing? We are keeping an eye on you. We are keeping an eye on your baby because at that age, you have a lot of complications. You have a lot of risk factors. You're likely going to develop hypertension. You're likely going to develop diabetes. You're likely going to have weight issues. You're likely going to have abnormalities. You're likely going to have syndromes. So we keep an eye on you. We likely also advise you to go for genetic counseling because the possibility you'll have challenges increases the older you become. But guess what? It's a challenge. You can still overcome it and you can still come out on top. There are so many women that had their babies in 40s and their babies were perfectly fine. But the point I'm making is to get help. Whenever you are pregnant, get help. Get help, okay? So the answer is yes, my dear. Very important question. Okay. Does follicular size determine egg quality? Yes. There's a particular size of follicle that will predict if your egg is going to be of good quality. Like if you're going for IVF, when we are stimulating you and we are doing follicular tracking, there's a particular size of follicle we'll see. We'll feel maybe it's not going to succeed and we can cancel the cycle. So the answer is yes. What is donor egg? Okay, so donor egg means for some reasons, either you have poor quality eggs or you don't have eggs. Now we look for another woman who must be within the age of 25 up to early 30s. Okay? So the younger the woman, the better. So we look for another woman. We make sure that woman is able to give good egg. We make sure the woman is not hypertensive. We make sure the woman is not diabetic. We make sure the woman is not smoking. We make sure the woman's health is perfect. Now we go to that woman. We give the woman a couple of drugs. And when we are sure the woman is ovulating, we collect her eggs. Now we go to the woman that probably has gone into menopause or has poor quality eggs. Then we collect the egg we collected from that woman that is younger. Then we give it to the other woman. By then, the other woman's husband would have given us the egg. So let me explain better. We collect good eggs from another woman who should be younger. We keep that eggs in one side. We collect the partner of the woman who her eggs, for some reason, is either finished or not good quality. We collect the sperm from that man. We join it with the egg from the other woman together outside the body of the woman. Then we take it back to the original woman's body. This is what happens in donor eggs. It's not everybody that will need it, but if you need it, please go for it. Can you miscarry before miss period? Yes. Now, some women, majority of women had miscarriage without knowing. Do you know that some of your delayed bleeding that later came out with heavy clot and pain, they were miscarriages? Some women will miscarry without showing the classical signs of miscarriage. That particular miscarriage is called missed abortion. Listen to me. You can be genuinely pregnant, but you've lost the pregnancy. You didn't know because you didn't bleed. You didn't have pain. Water didn't come out of your body, but your baby is no longer viable. That situation is called missed abortion or missed miscarriage. It can happen to so many women. Now, some women can have blighted ovum or what we call anembryonic pregnancy, or some women can have ectopic pregnancy in a situation where the baby will not be developing in the womb, the baby is developing in the tubes. Some women can have molar pregnancy. Some women can have chemical pregnancy. These are all pregnancies that are not viable. So what do I mean viability? They will not yield to a live baby. Unfortunately, something happened to the baby will not continue. So the answer is yes. You might be pregnant and you will lose the pregnancy without even bleeding. Okay? I don't know the exact cost of donor eggs, but if you go to the fertility specialist, they will advise you on what to do. What's the cost of pepperish all over your body, chest, 2 days before your menses? So if this has been happening about the time you see your menses, it's possible you have what we call PMS, premenstrual syndrome. Okay? So follow up with your gynecologist and they can figure it out. Guys, we've spent 40 minutes. Thank you for coming. Now, I'm going to adjourn this particular clinic, but my next clinic will be on Tuesday. Don't miss it for anything. If today is your first day of coming to my clinic, thank you so much. Remember to subscribe. Remember to watch other videos. Remember to practice what we taught today. Remember to be real. Remember to face your reality. Remember to take actions, especially if you're older than 35. Actions will yield results. Sentiments will not give you babies. Crying will not give you babies. Action can give you babies. So in the month of April, go out there and continue your prayer and continue your playing. Playing means every other day make love. Practicing means you need a fertility specialist. You cannot achieve this by yourself. You need help. I love you guys, and I'll see you guys again on Tuesday. Until I see you, how can you make an appointment with me? Please talk to my admin. My admin is going to set you up. If you're not in our group in Facebook, remember we are in Facebook. We are in Instagram. We are in TikTok. Of course, we are in YouTube, and we are in Twitter. So anywhere you see us, you can approach us and we can set you up, and you can shoot us an email. So my dear, why don't you send us an email? snowspirations@gmail.com. Admin, please share the email, and they can send us an email, and we can get you started. Okay? All right. I hope I've answered every question on the floor, and I hope you've understood the essence of your eggs in regards to your fertility and becoming pregnant. Until I see you guys on Tuesday, God bless you, and thank you for coming. Bye-bye for now.